Hi, everyone. I'm Joanna Sinwell. I'm the president of the board at NAMI Johnson County. Welcome. And I'm happy today to uh, welcome Ryan, who is with Community. And he's going to talk about the crisis helplines and tell us the ins and outs. I want to give a little introduction to Ryan, but Ryan, please chime in and tell us more about what led you here. He started with Community as a volunteer in 2018. He has a BS in psychology and a minor in music education. As director of Crisis Helplines, Ryan oversees the LGBTQI plus Youth 988 line for the center, as well as State 988 and University of Iowa Emotional Support Line. He is a Master Assist Trainer, ICH Accreditation Examiner, and presented on the effects of the developmental helping model on client mood at AAS 2019, Crisis Center Rapid Expansion for 988 at CrisisCon 2022, Creating a Culture of Feedback for Crisis Work at CrisisCon 2023, and has trained the FBI Crisis
Criminal justice.
criminal justice investigation service call takers in crisis intervention. So welcome, Ryan. Thanks.
All right. Thanks, Joanna. Appreciate that. Thank you all for being here. As mentioned, I'm Ryan Dickson. I'm Director of Crisis Helplines here. We're going to focus our talk today on the 988 side of what I do. And I know there's a lot in there, what that is and how it works. I'll encourage questions throughout, or if you want to save them till the end, that's cool too. And I don't, quite know what our level of knowledge is around the service here. So I'll start at the basic level, and I'll anything is appropriate that you want to ask, from just operational things all the way up to like what's the personal experience like working on the line. I won't focus so much on that, but if you want to know those kind of things, I think it's wonderful to talk about, and really helps advocate for our service. So yeah, once again, thanks for being here. I want to start, as always, with a disclaimer here for sensitive content. 988 is primarily marketed as a suicide intervention and prevention service, and as such, the topic of suicide may come up during our discussion today. So if there's a need for you to step out, it brings things up for you, that's understood. If you need additional support to work through what came up for you afterwards, my contact information will be there. We can debrief. I can stay and debrief, or we can connect another time. I just want you to know what's coming up, and make sure that you're as safe as you need to be. So I mentioned suicide is the main focus of that line, although there is a crisis component we'll get into that's it doesn't have to be suicidal crisis. Some data from 2020 for the whole country. I would have liked to had more updated data, but the 2025, we're still in process. I like to look at things in kind of the 5-year chunks. So we'll pull back to 2020. About 46,000 people died by suicide in 2020. And I want to draw attention to the language there. Many people have differing attitudes and belief about suicide, as you would with any complex topic. Professionally, we'll use terms like died by suicide as opposed to committed suicide or something like that. Or you may hear the verb suicided. Died by suicide or suicided are considered best practice terms because they avoid the negative connotation that comes along with committed. That being said, if in our discussions, somebody says committed, I'm not going to, shame anybody. That's part of the, cultural parlance, and I understand, language takes time to adjust, and we may not be there yet. So I just want to bring that to folks' attention and help spread that piece of education. 12.12 million adults, which is over 18, had serious thoughts of suicide. And you'll see 3.4 million adults made a suicide plan, 1.2 million made an attempt at suicide, and a staggering 1 in 200 suicides, and this means deaths by suicide, are youths, so folks under 18. You'll notice the numbers step down significantly the more intense we get. So we can talk about part of the safety assessment we do on the line, but at community, what we employ is we're looking for a plan for suicide. Do they have the means to carry out the plan? And do they have an immediate time frame, generally less than 24 hours? And if all three of those are in place, they may be considered an imminent risk. I'm seeing. Sure, and I'd be happy to send the slides after this, Tara, as well as encourage you to visit uh, the CDC website. Um, and I believe the Mayo Clinic as well have some more interactive graphs that you can look at that break down rates of suicide by demographic, age, race, gender, all those sorts of things. And you can adjust the sliders of time and whatnot. So you get more information, up-to-date information there as well. Yeah, so looking at plan, means, and time frame for imminent risk, where imminent risk is considered, we need active or immediate intervention, perhaps through uh, law enforcement if it comes to that, unless we can get to like a safety plan where they can distance themselves from the means, or so, some other way disable their plan. So you'll notice it's quite common for folks to have thoughts of suicide. Um, Less common to have made a plan, but you'll also notice that many more people have made a plan than have acted on the plan. So it is a cause for concern if you notice a plan, but it doesn't mean that action will be taken. And there's still hope for intervention, or things to change at that point. So I want to draw special attention to those gaps in the numbers there. One stat I would also like you to consider here, this rate of death by suicide, if you were to imagine that suicide only happens in one locality, to kind of make this real in a way for us. I assume we're all residents of Iowa here. Um, if that only happened in Cedar Rapids, it would only take 3 years for there to be nobody in Cedar Rapids. That's how quickly this moves. So it's a serious, serious, serious issue um, that we're quite fortunate to have services like 988 help intervene in what really is an epidemic. Stats related specifically to Iowa for 2020, 550 Iowans unfortunately died by suicide. You may be surprised to see it's the second leading cause of death for ages 14 to 44. 82% are males, and this aligns with the national trends. The most, it depends on how you cut it, but the most death by suicides occur for white men, I believe, in the 30 to 50 age range. But as you look at the CDC stats and other things I mentioned earlier, you'll find that other populations are disproportionately affected by suicide. So Native American populations have a high rate of suicide. Trans and LGBTQ youth are disproportionately affected by suicide ideation. Firearms are the most common method. Firearms are the most common method used in lethal suicide attempts across the board. So again, this matches national trends there, as well as alcohol being present in 36% of suicide deaths. Any substance that impacts reasoning capacity is a major factor for whether or not a suicide attempt ends in death. Another piece of language we might want to be mindful of, we wouldn't say that a suicide attempt was successful. But again, that puts sort of a positive spin on something we would like to prevent and avoid. So just keeping the focus on died by suicide or stating the fact that a death occurred from the attempt is most appropriate. Common risk factors for suicide. The main one is prior suicide attempts. There is uh, what many psychologists might categorize as a natural inclination towards life, towards the survival instinct. And to overcome that instinct takes a significant push. I'm not sure I want to say motivation, but it takes a lot to get over that uh, uh, impulse that's keeping you alive and safe. And so if somebody has um, circumvented that instinct in the past, they've gained a certain level of comfort and may be more willing to try that in the future as opposed to somebody who has not yet crossed that bridge. Misuse of alcohol or other drugs, as we discussed, heightened emotions, lowered inhibitions, um, really contribute to that. What we know about suicidal ideation is that it's acute, meaning that it is very intense and within a brief window. So one of the main things we can do, we'll talk about, is intervening in a way that kind of runs out the clock on that window, keep them engaged in conversation, have it be in a directed way. We'll talk about how we can direct that, but if nothing else, just keeping them engaged and away from that is one of the best things you can do to prevent acting on a plan for suicide. But um, alcohol and drug use makes that very difficult to distance and reason intellectually and emotionally in that way. So that's a common factor in suicide risk. Uh, Mental illness should have a star here. I'm sure this group is aware we want to be careful about how we use that language. Just because someone has any mental illness does not predispose them to suicide. Or just because somebody acts on suicide does not mean that they have a mental illness, but it can be a factor if someone is in uh, perhaps a heightened emotional state as a result of that. We have the same sorts of concerns there where um, they may not be able to engage with ways of thinking or prior boundaries that they would in other circumstances. Access to lethal means is a huge one. It's why it's the second piece in our plan means time frame there. If we can distance persons from the means, uh, it drastically reduces the chance of a death by suicide. There's a free online training you can take called CALM. It's Counseling on Access to Lethal Means. I'd encourage everyone to check that out. And I don't have the dates on this. I'll just give you the high points, but I think it was in 1970s, maybe before that, maybe it's 1870s. I'm terrible with these numbers. They had an epidemic of suicides in Great Britain, and the means for the death by suicide was using a gas oven. Folks had, I believe it's Sylvia Plath who famously died that way, and so people would um, mirror that behavior because they knew it to be painless and effective. So when the government took notice of this, they changed the gas that was supplied to the stoves from coal gas, which is lethal and I think has a carbon monoxide component to it, to a non-lethal flammable gas. And suicides dropped by 70%, I believe. And that number never went back up. As soon as they reduced the means, it made a massive, permanent, seemingly permanent impact on that. I won't get political in this space, but you can, imagine what might happen given that example if we were to perhaps regulate or control other common means of suicidal behavior. Knowing someone who died by suicide. There is, I don't like this term, but if you're inclined to research this, you might see something called the contagion effect. Basically, knowing someone who has died by suicide or made an attempt um, has a kind of ripple effect, and it communicates some things to um, members of the community or family members or friends of the person, in some cases, that, oh, this is an option, uh, or I had been thinking about it, but I didn't think I could go through with it, and I see that they've been able to do that. Um, it's a quite impactful thing for youth if they know somebody who has made an attempt or has died by suicide. Their risk shoots way up because uh, they're quite impressionable. And one of the main things that we understand of this, there is often an outpouring of support that a person with suicidal ideation needs, and they may see that happening for a person who attempted and be like, this is a way I can get my needs met. That doesn't need to be a conscious calculation. I'm not trying to suggest that, anybody's doing any kind of manipulation. That's far beyond what I'm saying, but it does seem to have an impact in this way, where needs are sought to be fulfilled. Social isolation is probably the most common thing we encounter on the 988 Suicide and Crisis Line as the reason for um, having what we'll call suicidal ideation or thoughts of suicide. Not having somebody that you can relate to, a support network, having lost your job, going through a divorce, all these major life trauma events correlate with a breakdown of relationships and connection. And when they feel alone, there's also no other solution. They're doing everything they can to make connection, and that would alleviate the pain, but they don't have that. So suicide becomes an option. Recent loss related to that, as I say, breakdowns in relationship, divorce, job, exacerbates those feelings, and are oftentimes things that are irreversible. I'm not going to get that job back. We're not going to get back together. My family member is not going to come back to life, and it feels like the pain is irrevocable because the source of the pain is irrevocable. Warning signs for suicide. The main one you'll want to pay attention to is talking about wanting to die or to kill oneself. So Joanna mentioned I'm an assist trainer, which is applied suicide intervention skills training. It's put on by LivingWorks. That's a free training we do every other month. And if you want to go to their website and see what else is out there, excuse me, other organizations put that on as well. It's standardized. It may or may not be free depending on where you get it, but we do it for free. And in that training, we talk about invitations as messages that are sent out hoping for a response. And you may hear things like, I just don't think I can do this anymore, or I don't see the point of anything, right? So they're not just going to come out and say, I want to die by suicide, but they may give you statements like that elicit an ask from you, like, oh, what does that mean? Are you thinking about suicide? Looking for means, such as acquiring firearms or pills or ropes or sharp implements, what have you. Feeling hopeless or having no reason to live. Purpose is a huge portion of suicidal ideation alongside the isolation. If there's no point, then it's kind of self-evident, right? There's no point. Why continue with this if I'm not getting anything positive out of this experience? And then the last one here, we talked about plan, means, and time frame. That time frame is a huge one. Generally, less than 24 hours is what we consider imminent risk because of that acute nature of it. If they can be safe for now, um, they have a chance of reaching out and getting maybe long-term help beyond that. But if they have a specific time frame, it communicates that the plan is more likely to go forward. So what do we do about this? If the numbers are as big as we showed in the beginning, how can we possibly help? Well, that's what 988 is for. It used to be called the National Suicide Prevention Lifeline, or the NSPL. And you can still call 1-800-273-TALK, and you'll get that. You'll be connected to 988. But I think everybody could agree that's kind of a lot to remember when you're in crisis. What are we going to do about that? So I believe it was 2023, bipartisan legislation was passed, and the FCC helped adopt 988 as the National Suicide Prevention and Crisis Line. It's easier to remember. It's close to 911. It's 3 digits. But they also recognize that if they increased accessibility in this way, that we're going to need a lot of support to meet the demand. We already knew the demand was incredible, but for the first time in its history, the Suicide and Crisis Line was appropriately funded. I think they went from, I want to say, like 5 million nationally to maybe a billion in the first year. I'd have to look that up. We had a chat text contract with them. We had been doing that for the NSPL before on like a volunteer basis, and they would give us a phone stipend of like $5,000 a year, so like not really much. But the major chat and text contracts would be upwards of 6 million, to give you an idea of change in funding scope. So I mentioned what we did in the beginning. Phone calls. We can talk as long as somebody needs to help them choose safety as their option for the day. Chat through the website, 988lifeline.org. You can go there and talk on your browser, or you can simply text 988. And I think just this last year, all of the national carriers finally got on board and will route that appropriately. I think like Verizon was one of the first to adopt, and then T-Mobile, and then AT&T took a while, but we finally have all the major carriers on board. We provide emotional support through a counseling dynamic. Joanna mentioned I have presented on something called the developmental helping model that was developed by it was either University of Iowa, I think it was University of Iowa, and Art Turok in 1985, I believe. And it takes a lot from motivational interviewing, dialectical behavioral therapy, other sort of question-based techniques, and it's really focused on building rapport. We'll go into some broad strokes of what our model looks like. But it's focused on emotional support, and most importantly, non-judgmental. You have to hold that attitude if people are going to tell you something that is so dark and secret and personal and is stigmatized as suicide is in our culture. So if you call 988, you can rest assured you're going to have that kind of environment. Their training for the network is standardized in a sense. Like, everybody has to go through modules that 988 puts out that emphasize this as well. Centers have some leeway in adding things on that they want, but that's a core part of our message, is the non-judgmental aspect. In addition to the emotional support, we can connect folks to referrals if needed. We're part of what's called the continuum of crisis care. A big part of the 988 initiative was to increase the continuity of crisis care. So they wanted 988 to be the first point of contact for mental health, not 911. 911's the appropriate place for physical emergencies. 988 needs to be the place for mental emergencies. And then we would refer to mobile crisis if you need somebody to come out there and talk to you in person, or refer to services at NAMI if needed, for example, or connect them to, we have a new model in Iowa coming up, I think it's called Certified Community Behavioral Health Center, CCBHC. Get them connected to that and get long-term treatment. So we'll be one of the first points of contact in the continuum of crisis care. Follow-up is one of the main things you can do to help keep someone safe from suicide for now. So the idea that they have a conversation coming up, an obligation, something to look forward to. If somebody cares enough to take time out of their future day to say, hey, how are you going? How are you doing? Does wonders for helping people to choose safety as their option. And so that's a huge part of what we offer. We offer at least two to anyone who's expressing suicidal ideation. We'll do the initial one and then check up with you a second time if that's what they want. We also offer support for third-party callers. If you have someone that you're concerned about, you can call 988. We can walk you through briefly what you might look for or how you can support, how to have those conversations, how to advocate that they call 988, how to call with them. Yeah, that's also a big part of the work that we do. Okay. So I mentioned it's the suicide and crisis line. Well, what is a crisis? At Community, we don't define a crisis, but if you have to put something on it, here it is. Anything. Problems with friends, family, lack of food, financial emergency, divorce, serious illness, interpersonal struggles, school related things, an endless list of stressors. Or a series of small things. When I teach this to younger volunteers, I'll usually use my personal example of, like, if I go to McDonald's and I get 10 chicken McNuggets, they'll give you 2 packets of sauce. But if you get 20 nuggets, they only give you 3. And the ratio, if it was going to be equivalent, should be 4. And that doesn't line up. And I hate that, right? Um, that's a big deal for me, but maybe you're hearing that and it's like, that's chill out, man. That's fine, right? It's not a big deal. One, we don't use that kind of judgment, and two, it's real for that person. We might ask a question of, like, what is it that makes you hate that so much? And for me, I would go on to say, I feel like this is just another example of a corporation trying to nickel and dime me out of something that they owed. Like, they're lowering the quality of my experience just to pinch one more penny. I'm like, okay, so you feel taken advantage of. Like, yes, exactly. Now we've connected to the emotional content behind the particulars of the crisis, and that's really what's important. So that's what we focus on there. Modalities here, you can dial 988. I mentioned you can chat or text us. We also have specialized queues. So if you call 988 or text and you don't press any of the auto prompt buttons, you'll be forwarded to a general line. But you may also press one button to be connected to the VA version of Lifeline for veterans, and you can get peer support through the VA that way. It's mostly staffed by veterans, I understand. There is a Spanish-speaking line as well. Excuse me. And Community is very proud to be one of 4 centers in the country, alongside the Trevor Project, to administer the LGBTQIA plus youth. And if you're not familiar with the acronym, lesbian, gay, bi, trans, queer, intersex, asexual, and the plus is for anybody else who might not be accounted for in the letters there. It is designated as a youth line. However, the demographics of the folks that we talk to, we get more veterans than almost anybody else as a group on that line. And the reason they say is, the counselors we call it the QT line for short. On the QT line, they just get it. Right? So we serve all persons on that line, regardless of identity, classification, demographic, what have you. Anybody's free to use it. So what can you expect? Phone calls are answered under a minute nationally. put a note here for geo routing. What the system does is it looks at your zip code, not zip code, sorry, that's for chat text, your area code, the 3 digits at the beginning of your phone number there, looks up where that should be in the table of zip codes, and then tries to find the crisis center part of the 988 network that's closest to you. I should go into that too. The 988 is structured as a network of centers. So community is one of those. Foundation 2 in Iowa is another 988 center in Iowa. So we have kind of a special arrangement in Iowa compared to other states. Most states, it's probably one center that does everything, or they have one phone center and one chat and text center. We kind of do both. So if you called 988 in Iowa and you have a Iowa area code, it'll go to Foundation 2 first. If they're not able to answer in 20 seconds, it would kick it to us. And if we're somehow unable to answer in a further 20 seconds, then it kicks it to a national loop. And you get passed from center to center until eventually somebody will take that call. What 988 allowed to happen is that nationally, the average for getting an answer to your call is under a minute. So you do not have to wait long at all, even if your local center is full.
Ryan,
Yes.
is there a way, for example, I have a 970 area code, which would send me to Colorado.
Hmm.
But if I told the person who responded that I'd rather be sent to someone in Iowa at 319, would they be able to do that?
I love this question. Yes, absolutely. We have protocols and a table of codes that we can put in to transfer you to any state that you would want to get to. Now, we may not be able to get you to a specific center, but I can at least get you to the state where you need to go.
Okay, thank you.
So again, Iowa, because we have that kind of special relationship, if you called, I could at least get you to Foundation 2, but I may not be able to get you to my center because we're the phone backup. We are primary on chat text though. So if you try chat text in Iowa, you'll get to community first before it is offered to Foundation 2 or anybody else. Chat text have an average speed of answer of 20 to 30 seconds, so it's even faster. Answer rates nationally for chat and text are 98%. Phone's a bit lower, I think in the 80 to 90 range, but that has more to do with technological complications of how phones work and people's willingness to endure old music and messages. We have a high rate of what's called a quick abandon, where they'll call and then they'll hang up in maybe less than 15 seconds. So there's not even really a chance for it to get routed to somebody before the contact is ended. So that's why those numbers are a little bit lower. But very high answer rates and connectivity across the board. If you reach a counselor in Iowa, they will be assist trained, applied suicide intervention skills training. This is the gold standard for suicide intervention that's designed for anyone to be able to use, a member of the public, professional. It has broad spectrum application. So anyone at my center or at F2 will have this additional layer of excellent training to be able to help people choose safety and make a safety plan that they can engage in after the contact. Further going into expectations, here's how we do it. We think of it in sort of these broad stages. If you take assist, you'll have 3 stages broken down as well. This is not the assist model. This is adapted from the developmental helping model I mentioned earlier. But in stage 1, we are identifying the crisis. We're hearing this story. Okay, what is it that brought you to this place? Yes, the particulars of your situation are important, but what are the emotions behind them? One of the things new counselors may say is, I'm just not sure how I'm going to be able to relate to somebody, like I've never been through a divorce, or I've never lost my job, or whatever thing is, or I've never had a truck break down and I couldn't, get to my friends and I'll never see them again. Well, maybe not, but you have had a sense of loss. You have had a sense of disappointment and heartbreak and changing identity, and there's emotions behind those particular events that are common to all folks. So that's what we focus on. And we do that through empathy. We teach empathy as a skill. A lot of things, a lot of newer counselors also kind of struggle with this concept of, well, empathy is just something you have or you don't, right? And I'm not going to debate that here, but you can teach it as a skill, and I know it because I learned it, and I teach it. And the way that you do that is you identify what you think the emotion is behind what they're saying, and then tie it to the reason. So a short formula for that could be like, you feel X because Y. So you feel devastated because of the breakup. Excuse me. You also have the option to modify your intro to make it match your voice. Like, wow, what I'm hearing is that you're feeling devastated because of the breakup, or I'm getting the sense that this breakup has been one of the most devastating things you've experienced. You can swap the order, right? So identify what the emotion is, reflect it back to them, and see what their response is. Open-ended questions are a big part of helping them tell the story. Who, what, where, when, how. You'll notice why is missing from that list because asking why can put folks on the defensive, so we don't do that. But open-ended questions are questions that facilitate more detailed answers, where a closed question would be one that elicits a yes or no response. So, um, did you like the Avengers movie? Yes. Okay, cool. What did you think about the Avengers movie? Well, I thought it looked great in this, that, and the other, and we can go into detail. And just general awareness and attentiveness, listening for those cues that may not be spoken directly. Hesitation, silence. Silence can be a space for processing. So being aware of that, maybe calling attention to it. Uh, I'm hearing that it's taken you a while to get your thoughts together here. It must be really weighing on you in this way. So there's even an opportunity for empathy in that space. Exploring feelings and refining the issues would be the second piece. Once we've kind of figured out what happened, let's talk about how you feel about what happened. Additive empathy just means picking up on the underlying pieces of it. So not only are you heartbroken over the breakup, you're furious because of how it went down. Like maybe they're not saying that specifically, but you're picking up on it from their tone. So adding those kinds of things in. Self-disclosure is kind of a double-edged sword. We can use it to build rapport, but we want to be careful. We don't want to make the conversation about us. So if we use it like, yeah, I went through a breakup, it really wrecked my life, and I was in a dark place for a long time. How does that relate to you? How does that check out for you? So immediately putting it back on them. Confrontation is a scary one here, but it's incredibly powerful. A lot of people see the word confrontation and they're like, I am afraid of that. I don't want to do that. What we mean by confrontation could be described as reframing, but calling out inconsistencies in thoughts, behaviors, beliefs, statements. Like on the one hand, I hear uh, you say X is really important, and on the other hand, I hear you doing Y that is counter to X. And just let that sit and let them kind of feel the dissonance of that situation and resolve it however they want. Oh, yeah, X is more important to me, or no, I think Y is more important now that you point that out. And that's really helpful for them to introspect on their own, and we don't have to push them to one conclusion. And then immediacy, along with confrontation, is one of my favorite skills. This is calling attention to dynamics that are happening between us. This makes the interaction genuine. Maybe you got off on the wrong foot. So immediacy clarifies expectations of the role, um, and addresses the conversation or the dynamic that's happening between you rather than the conversation about the crisis. So, man, it seems like what I said was really upsetting. I'm sorry, my intent was this. I can change that going forward. I apologize. That's one function of immediacy. Or clarifying your role. We don't give advice. So if they're like, I need to know what to do here, we might say, my role is really just to work through things with you. I'm not really able to tell you what the best answer is. I'm not sure. And maybe they keep asking, um, saying, calling attention to that dynamic. I'm hearing from you that an answer, a concrete answer from me is really important. And it seems like um, it's challenging and perhaps upsetting that I'm not able to give that to you right now. It's a very powerful skill for setting boundaries as well. And at the end, once we've heard the story, we've explored the emotion behind it, we've identified the values that connect the person to life, we can go into an action plan. What are you going to do if these feelings and thoughts come up again? Who are you going to reach out to? Are you going to call us? Are you going to contact MCR? Are you going to look into what NAMI offers you tomorrow? Uh, those sorts of things. So, follow-ups, referrals, anything that helps increase safety for now. So how does this work from a structure level? So SAMHSA, Substance Abuse Mental Health Services Administration, is the one who administers the Lifeline. They procure funding from Congress and then distribute it to Vibrant. Vibrant is the organization. They are a crisis service organization themselves, but they're the administrator of the contract, and they disperse it to member centers like Community, who are part of a network of 200 centers to do the job. We talked about they're routed to the closest center, and if they're not able to answer, it gets passed to that circuit of 200 centers with many staff at each one. So if you call and you wait, or you text or chat, you will get an answer. We talked about this earlier. Yeah, text as an option is newer. Community is one of the centers who piloted that in, I want to say, 2022, before 988 even went live. A uh, a carrier reached out to Vibrant and said, "Did you know folks are trying to text 1-800-273-TALK?" They're like, "No." I was like, "Well, they are. So if you want to enable that, you could probably reach more people." So we piloted that, and it took off. Couple months after its inception, text actually overtook chats in Iowa as the main method of communication in the digital sphere. Now they've kind of balanced out. They found some equilibrium, but for a while there, that was the main way of talking to us. A big thing I want to emphasize here is youth access to mental health care. We don't verify age or anything like that. We're not licensed counselors, but we do provide a critical service to low barrier, low barrier to entry service for um, underprivileged populations, including youth. There's another point I wanted to add on to that. Um, it'll come back to me, but yeah, low barrier to entry service for youth that may not have access to anything else otherwise. So here's some stats just from our center to show you the impact here. Prior to the launch of 988, we would do maybe 100 chats and texts on the Lifeline. In January to June, 100 total, right? And we did a lot more on the national, but I just want to give you the scale from that. So that's over, what, 6 months? Post 988, our average for this fiscal year, our fiscal year goes from July to June. We're already averaging 910 a month this year. We've already seen over 18,000 chat and texts in that time period, and over 67,000 calls. Now, the calls include national numbers. The LGBTQ line that I talked about, that's a national contract. We're one of 4 centers in the country that do it. So yeah, those are going to be massive. And we're also serving many more people than just LGBTQ persons on that line. About a third of the ones from Iowa chat and text are from minor persons or concerned about them, like a teacher or parent. Okay, so we're a huge part of the continuum of crisis care. Our main thing is that I hope to see increase is 911 diversion. We're part of a pilot in Iowa with many different PSAPs, which I think is public safety access point. Your 911 dispatch centers, uh, fire, police, EMTs. Uh, Many of the calls that they get are mental health related, not really appropriate for that service. So we have a connection where they can forward that to us and Foundation 2, and we'll take it over. Now, if they're at imminent risk, they may be about to die by suicide. We can pass it back to them if needed, but uh, we really should be taking about half the calls that are coming in to the centers I've spoken to. Referrals to mobile crisis. So mobile crisis, if you're not aware of that, that dispatches throughout Iowa. They do what we do, but they do it in person and they do it in teams of 2. Iowa, I think everywhere does not have, it's called a co-responder model where they're there with police. It's just counselors. Other states may do just counselors, just police, or a co-responder. But we find the just counselor one to be most effective, most client-centered. We connect to access centers, we'll follow up, get you to local resources, and make referrals to the long-term care. All right, what can you do to help? Please talk about it. There are still places I go where it's like, does anybody know about 988? And one of 2 things happens. Everybody raises their hand or no one raises their hand. It's a very interesting kind of dynamic. Um, Iowa City has 988 posted on the police cars, which, we can talk about the impact of that. I appreciate the effort to communicate and make it publicly visible. You'll also see posters on any kind of bridge that you go to that have 988, because that is another common means of acting on a suicide plan. So talk about it. Hey, did you know? And remember, it doesn't have to be about suicide. It can be about anything. I'm having a bad day and I want to talk to somebody and everybody knows asleep, or I don't want to talk to them, or whatever, right? We'll talk to you about anything. Help destigmatize, uh, listen and refer. If you can donate time or resources, that's super helpful. I'll make a plea right now where I have right local state governments emphasizing the needs for this service. That's bolded. Uh, I don't know how many of you are affiliated with nonprofits here. I would assume most of us, so you know that the boat we're in. But if you're watching this later, or if you're not affiliated with it and you don't know, nonprofits are under massive threat right now. Funding freezes. SAMHSA, who I mentioned, administers the Lifeline and passes it through Vibrant, recently had massive layoffs, and my understanding is there's only 2 persons left overseeing it at the SAMHSA level now. Dr. Richard McKeon, who's one of their main suicide researchers, and James Wright is the logistics administrator. So our future is uncertain, and the LGBTQ line specifically has come under fire from this administration as being examined. We currently don't know if that contract will exist past the end of their fiscal year in October. We have a huge volume on that, and like I said, we serve everybody on that line, veterans especially. So if you're talking about it, bringing up, you know, that volume isn't going to go away. It's going to go somewhere, and they still need help, and it's it's everyone that we know and care about. It's veterans, it's LGBTQ persons, it's youth, it's our brothers and sisters and neighbors and friends and family. It's everyone. So advocacy in this way is the most important thing we can do. I haven't left you a ton of time for questions. I can't believe I talked that whole time. But we've got some time if you have some.
We're awfully glad you did. You have a wonderful presence. I can imagine speaking to you on the phone would be very calming.
Well, I appreciate that. Thanks.
But Ryan, I did actually, you answered my question. I had heard that the LGBTQ line in particular was in danger and that SAMHSA was getting essentially gutted.
Yeah.
So I want to encourage everyone to, write to our senators and call them, do whatever we can to protect this important resource. I wanted to ask too if you felt comfortable, if your staff felt comfortable with what NAMI has to offer in terms of, when you refer people after the, at the end of the call, do you feel like you have enough information on NAMI to um, help direct people to us and
I would
our,
always like more.
okay. All right, I get Laura. I think Laura's on the phone, isn't she?
Yep, I'm here,
Yes,
Joanna.
Good. Well, maybe you could check in with Ryan to make sure that he has what he needs, because we have wonderful peer services, and that might be just what people are looking for. Especially,
absolutely.
Absolutely.
yeah,
Yeah.
great. Okay, thank you.
Thank you. Yeah. I don't have to tell you all how important and effective peer support is, and folks often say on the line, like, no one's going to understand me. They may not even know that peers exist. So yes,
Right, exactly.
would love to have
You know,
anything
and
you
I
need us
imagine
that way.
some calls are from family members who, are at their wits' end trying to help their loved ones. That's often what we hear and why people um, hear about NAMI is our family support services and the
Yeah,
resources we offer.
yeah. Third party is a big portion of the calls we take. So absolutely.
Great.
Um, I have a question.
Yeah.
If someone wants to volunteer for one of the helplines,
Hmm.
what does that process look like, and how would one go about being a volunteer?
Right. Um, I always am grateful and moved by the interest in this. We used to be a volunteer-driven program prior to 988. With the advent of 988, with the increase of funding, also came an increase in accountability to metrics like answer rates. Vibrant looks at those seriously. Unfortunately, we found that a volunteer program did not allow us to meet those answer rates to the degree that we needed. So community currently does not offer volunteer opportunities for the line. That might change in the future. I'm always looking for a way to get it back. They were the heart of their program. It's where I come from. I still love it. But it's just not a possibility in the current climate. That may change with how the contracts look after October. But in the meantime, any volunteer opportunities are posted on our website at builtbycommunity.org. I mentioned it's not just us that's under threat here, right? Every nonprofit. So our food bank is definitely feeling the squeeze, and if you're inclined to volunteer there, they certainly have openings and need. And the trainings that we offer in terms of assist and things like that are applicable there. You can take the suicide intervention model and apply it to a crisis situation. And many folks who are at the food bank are finding themselves in crisis and may need somebody to talk to. So you can employ those skills in that way. Yeah. Thank you for that question.
Ryan, this has been so helpful. Thank you. I learned a lot.
I'm glad to hear that. And my inbox is always open. I love questions from the community. So if you think of some later, or you're watching this later and you're like, I wish this was addressed, I'm here for it. And I'll typically respond within 24 hours. So I look forward to hearing from you.
Thank you. And thank you for all you do for our community.
Likewise. Thanks for having me.
Thank you. All right. See you guys next month.